Yeah, good morning all. So today we are going to start the topic that is called as a monsoon diseases. So what are the monsoon diseases? Let me discuss. Say this season is monsoon diseases are very common, you know well, right? So what are the common monsoon diseases we observe, right? So in that some of the diseases are which are vector-borne diseases, some are the contaminated diseases, right? So in this communicable, these are which you are displaying here, these 6 types are very right, so dangerous monsoon diseases which you have to observe. In that the malaria and the dengue, this both are the vector-borne monsoon diseases, and here the influenza, right, so and the cholera and the typhoid and the hepatitis A are the most common contaminated monsoon diseases, right. So in this 6 types, so one by one we should discuss, because of in this monsoon condition, right. So these 6 type of diseases are very dangerous, and it's a high rate to spread the person to person, and most contaminated diseases which you have to observe, right. So in this, so especially if you have to discuss all these 6 types, almost there is a common sign we observed that is called as a fever. See, the fever, you just remember that the fever is a sign, not a disease. It's a very important to remember. Fever is a sign, not a disease. So this fever sign is common to all these diseases, almost all, right. So except the cholera, all the diseases we can observe that the sign of a fever. Fever is a sign, not a disease. It's a very important to remember, right. And next in continuations, let me discuss all the fever associated diseases and how we have to identify the fever. See, the character of a fever is different in each disease, but while we are observing the fever is a most common sign we observe, right. In that continuation, so the malaria, right. In the malaria actually the malaria is a parasitic disease. You just remember, the malaria is a parasitic disease. So it caused by the parasites. So there is a particular parasite which has to causing the malaria. And here one more is there, typhoid. Typhoid is caused by the organism that is called as a bacteria. So here the organism of malaria called as a parasite, the organism for the typhoid called as a bacteria, and the organism for the dengue called as a virus, and the COVID-19 organism called as a virus. So in that, and influenza also, added the influ, right. So then here the influenza also virus, See, the dengue and COVID and the influenza, most common viral family, that is called as a RNA family, very dangerous virus family. So RNA, DNA, there are the 2 variant families in the virus we observed. In that, the RNA family virus is very dangerous family of virus, right. So if we have to observe the dengue, COVID-19 and influenza, these 3 are the belongs to the virus family that is called as the RNA virus family, which is very dangerous to affect the body, right. And here if we have to observe that the secondary cause of these fever associated diseases, in that, for example, the secondary cause for the malaria, the secondary cause is a mosquitoes, and for the typhoid the secondary cause we term as a contaminated food, water, and poor hygienic condition. For the dengue we have to observe there is a mosquitoes, and for the COVID-19 and influenza mostly we observe that there is a droplet virus, right. So droplet spread mostly we observe, right. So this is about the secondary cause. And if we have to observe the character of a fever in each conditions, see, if we have to observe the character of a fever in the each condition, in that, for example, the malaria, in the malaria what is the character of a fever, right. So in the malaria the character of a fever in the 3 stages, cold stage, hot stage, and sweating stage, right. So you understood this point, it's a very important for the character of a malaria fever character in the 3 stages. The stages simply what we are terming the cold stage, that could be, right, show the shivering and the chills may start, right, and then it start, then in next stage there is a burning, right, so hot, that is called as a hyperpyrexia along with the headache, and in the third stage we observe that there is a sweating. So, in continuation of malaria, I will explain what exactly the duration of the cold stage, what exactly the duration of the hot stage, what exactly the duration of the sweating state in continuation. But you just remember this point, what exactly is, what is the malaria fever character. This is what the point we should remember. So, here the malaria fever character should be cold. First the person can be shivering and chills, and then start the increasing of the temperature along with the headache, and then we observe there is a profuse, right, so sweating can be observed, right. So, this is a character of a fever in the malaria condition. So, in the typhoid condition, what is the fever character? How the fever is associated with the typhoid? In the typhoid, the fever which we called as a, that is called as a step ladder fever. Step ladder fever, you know the step ladder, right. So, step ladder is for example just like right, so it is dropping and again raising and then dropping, again raising and dropping and again dropping, right. So, here we observe that it is a hyperpyrexic condition, as well as at the morning the fever will be dropped, again it can raise and drop, again can raise and drop. So, this character type of fever which called as a step ladder fever, if we have to monitor the vitals of a person or the child or the victim, right. So, we observe that is called as a step ladder fever. So, step ladder fever is a type of fever in the typhoid. So, that is very important, you just remember. But when we have to come to the dengue is a very dangerous character, right. So, because of here the character of a fever just like start with the high grade fever, the fever start with the high grade fever, and in next stage it comes to the, right, so along with the muscle and the joint pain. So, we called as a break-bone fever, right. So, that start with the high grade, then comes to the break-bone fever due to the character of a joint pains and the muscle pains and the bone pains. Later it comes to the hemorrhagic fever. So, these three characters you just observed in the fever. There is a high grade character, breakbone character, and the hemorrhagic character. So, these three types of characters which we have to see, that is called as a dengue. So, dengue fever is very dangerous because of these three severe characters, right. So, that is a initial character, then go to the worst, then go to the very worst, right. So, this is what the character we observe. And in the COVID-19, as you know well, the fever character just like a flu-like character. So, the fever and the flu combination we observed, that is called as a COVID-19 and influenza type of fever character. So, what exactly the identification? See, if you have to observe the character of a fever, in that the temperature during that. So, temperature here if we have to observe, in the malaria there is a 101 plus temperature can be observed in the thermometer if we have to check orally, and if we have to observe in the typhoid there is a 100 plus temperature can be maintained for the typhoid diseases, and in the dengue diseases there is a temperature can be maintained, that is called as a 104 plus degree of temperature can be maintained, especially in the dengue fever, right. And in the COVID there is a temperature can be maintained 98 to 100 degrees Celsius Fahrenheit, right. So, this is what very common so fever associated diseases, and we can easily to identify the differentiation of the fever in the different type of the diseases. So, by this different type of the character of a fever, we can segregate either the malaria or the typhoid or the dengue or the COVID-19 or the, right, so any other influenza diseases, right. So, that is what the fever which you have to observe. And coming to the continuation in that, so here we observed the next that is called as the most common vector-borne diseases, as you know that, right. So, in this season the most common monsoon season vector-borne diseases which we called as a dengue and malaria. So, this dengue and malaria we called as a vector-borne diseases. Dengue and malaria mostly we called as a vector-borne diseases. So in this vector-borne diseases, what we have to observe, right? So what exactly we have to observe in the vector-borne diseases? See, in the vector-borne diseases, there are mostly by the mosquitoes bite. Mosquitoes bite. So in this mosquito bite, here we just remember what type of mosquitoes are causing the malaria, what type of mosquitoes are causing the dengue, right? So here to so specific mnemonic we should remember in that the day bite mosquitoes, day feeder, the day bite mosquitoes, or the dengue mosquitoes, right? So mostly the day bite mosquitoes which cause the disease, that is called as a dengue, and there is a night, especially the moon bite mosquitoes, that is called as a malaria. This is what a simple code which you have to remember. So day bite mosquitoes mostly called as a dengue, and moon bite mosquitoes which we call as a malaria. And here one more character also we observed. This dengue mosquitoes we called as a tiger mosquito, because of here see the legs of the mosquitoes, the right, so the here we observed that there is some right, so patches we observed, the patches like this patches we observed in the tiger. So this mosquito we also called as a tiger mosquito, tiger. So mosquito, here we observe there is a tiger mosquitoes, right? So and here this mosquito we called as a moonlight, especially night feeder mosquitoes, or the malaria. And here one more character also we observed, especially this dengue mosquitoes are, right, so especially surviving in clean water. They like the clean water, you know. So mostly these mosquitoes are like clean water, clean stagnation water. Stagnation water. So here the clean stagnation water mosquitoes, mostly we observed this clean stagnation water mosquitoes, that is called as a, right, so that is called as a clean stagnation water mosquitoes, that is called as a dengue mosquitoes. But here if we have to observe that, so there is a, right, so in the malaria mosquitoes, they are mostly, right, surviving in dirty water, right, so they are mostly surviving in dirty water. So there is a dirty water mosquitoes, that is called as a, so dirty stagnation water, stagnation water mosquitoes, that is called as a malarial mosquitoes. So malaria mosquitoes, especially this malaria mosquitoes, we observe the Anopheles. So Anopheles, right, so especially they like the dirty water, and Egypt, right, so Egypt they like mostly clean water. So Egypt family like the clean water, and Anopheles family mostly like the dirty water. This is what we observed. If there is a dirty water stagnation, there is a more surviving of the malaria mosquitoes. If there is a clean water stagnation, there is a more surviving of the dengue mosquitoes. This is what a smart clue which we have to write. So variant the mosquito bites and the mosquitoes which we are causing which causing dengue and the malaria, right? So coming to the next continuation, if we have to observe one by one condition, in that most dangerous condition we called as a dengue. Here the dengue is most dangerous condition, and the dengue fever is most dangerous fever. This fever we also called as a, what we are saying, this another name of dengue fever we also terming that is called as a, simply dengue is also called as a break-bone fever. Break-bone fever. This dengue fever we also called as a break-bone fever. And if we have to discuss about the background of dengue, we can see here. The dengue belongs to the family we call as a group B arbovirus family. The family called as a group B arbovirus. It's very important to remember it's a virus family, especially RNA virus. So this is a virus family, and especially RNA virus family virus. So it's very, very dangerous to the body. So just before we classified that if the RNA virus family, either the COVID-19, either the dengue, or either the any other type of RNA family diseases which are very dangerous to the family, very dangerous to the health, right? So in that particularly if you have to observe, there is a group B arbovirus family, right? So dengue, and here there is a some serotype variant we observed. In the serotype variant of the dengue, there is a dengue 1, 2, 3, 4. In that, most commonly the dengue virus second, dengue virus second, this serotype dengue virus second, if we have to detect in the serological test, in the serological test, if we have to detect the variant of dengue virus 2, that is the most dangerous form of dengue, most dangerous form of dengue, and there is a rapid destructions we observed, destructions of orbices we observed, and here there is a particular background of dengue. There are the vector-borne diseases, as you know, the vector, that vector name is called as a female Aedes and Aegypti, right? So female Aedes aegypti is a vector mosquito, right? So this mosquito we also called as a tiger mosquito because of the legs of the tigers scars, or right? So we observed in the mosquito family. So in that mosquito we called as a tiger mosquito we also called as a female Aedes aegypti, right? So mosquito which are causing the dengue. And here particularly if we have to concentrating about the dengue, here we observed there is a incubation period. It's very important to remember that the incubation period of a dengue, here 3 to 10 days, there is a 3 to 10 days, that is a most common incubation period. So in this 3 to 10 days, average if we have to discuss, that is a 4 to 7 days. This 4 to 7 days is the average period, and most commonly if we have to term, there is a 3 to 10 days. 3 to 10 days. 3 to 10 days is a most common period for the dengue condition, right? So then if we have to observe, there is a particularly the symptoms of dengue fever we observed, and this illness can be in 3 phases. The phases number 1, that is called as a febrile phase, then it goes to the critical phase, and it comes to the recovery phase. See, the dengue is a danger. At the same time, if we are properly treating, even the critical case also, critical conditions also, there is a survival chance, more survival chance we observe, right? If the patient in the critical condition also, there is a next stage that is called as a recovery stage. So in the recovery stage, there is a survival chances. So what exactly happened in this febrile stage? See, the febrile stage especially we observed there is a sudden onset of fever, headache, mouth and nose bleeding, muscle and joint pains we observed, vomiting, rashes, diarrhea. These are the characters which we have to observe. There is a phase called as a febrile phase, and in the next phase that is called as a critical phase, due to this bleeding, due to this bleeding hemorrhagic, there is a hypotension, pleural effusion, ascites and gastrointestinal bleeding can be formed. Here these characters which reveals the critical phase of the patient. If you are not properly concentrating during the critical phase, the case goes to the worse. So you just focus on this management of critical phase, and next continuation there is a recovery phase. In the recovery phase we observe there is a alternation level of the conscious, seizures, itching and slow heart rate. Then it comes to the normalizing. So these are the phases of illness which we have to observe in the dengue fever. Along with that, in the next continuation we have to observe that what are the stages of a dengue in how many stages, how the dengue is traveling, what is the journey of the dengue. If we have to observe the journey of the dengue, right? So in that, the first there is a undifferentiated stage. So in the undifferentiated stage, what exactly happened is that there is a high grade of fever, but we are not particularly classified that is the fever belongs to the dengue, right? So that's why that stage we called as the undifferentiated stage. After the undifferentiated stage, if we have to observe, there is a classical dengue fever stage. So this classical dengue fever stage, simply CDF. There is a CDF stage, this classical dengue fever stage we observed, there is a stage we called as a break-bone fever. Because of here the character we observed, there is a high grade fever and chills, and there is a intense headache. That headache is particularly we observed, there is a retroorbital pain. So this retroorbital pain, most commonly we observed here the retroorbital pain along with the high grade fever and the chills, and one more special character. Number 1 character, high grade fever, second character headache with the retroorbital pain, and the third character that is called as a muscles and joint pain. So here if we have to observe in the classical dengue fever, in the classical dengue fever stage, three major character we should observe. The fever may be the high grade with the chills, and the headache, especially the orbital, let us so especially the orbital retroorbital head pain, retroorbital pain we observed. Along with that, the third character which we observed, there is a severe form of muscle, joint and bone pains we observed in this character. So by that, so this fever, dengue fever, we called as a breakbone fever. So the reason of to calling the breakbone fever, because of there is a characteristic sign we observed, the characteristic symptom we observed, that is called as a severe muscle, joint and bone pains may be complained by the person. So by that, so we observed that there is a chance of a breakbone fever. So here these three characters we observed in the classical dengue fever. Once again I am repeating the characters. There is a high grade fever with the chills, intense headache with the retroorbital pain. Along with that, the third character, there is a severe muscle and joint pain and the bone pain can observed. By that we called as a, that is a breakbone fever. The next continuation if we have to discuss, that continuation next, so that is called as a dengue hemorrhagic. So in the dengue hemorrhagic, if we have to discuss, in the dengue hemorrhagic, so this is a next continuation stage. In the dengue hemorrhagic, so the fever may be the acute or the onset character, history, and there is a one more character that is very important in the DHF, dengue hemorrhagic phase. In that is called as a low platelet count. Here the fever may be continued or the onset history, and followed that there is a low platelet count. So in the second stage we observe there is a low platelet count, especially that is called as a thrombocytopenia. So during the thrombocytopenia, the platelet count may be right, so there is a 1 lakh or less than 1 lakh. So if there is a 1 lakh or less than 1 lakh, we observed that is a most dangerous sign of the dengue, right? So here we may observe one more character, that is called as a hemorrhagic manifestation. So in the dengue fever, especially in the dengue condition, the very dangerous sign we observe, that is called as a hemorrhagic manifestation. This hemorrhagic is nothing but bleeding. So bleeding may be the internal bleeding or the external bleeding. So this internal bleeding or external bleeding, especially the main complication of bleeding we observed in the dengue fever, that is called as a epistaxis. This is very important point you just remember. So the main complication of bleeding for the dengue cases, that is called as a epistaxis bleeding, and there is a skin bleeding also we observed. So in that skin bleeding there is a petechial bleeding. So petechial bleeding, especially there is a more than 20 petechial bleeding, just like a oozing bleed, you know, right? So oozing bleed, so we observed in the skin, and it goes to the purpuric state, purpura, or it may be ecchymosis. So there is a some bleeding changes we observed in the skin. So either the petechial or the purpura or the ecchymosis, this most common type of bleeding in the skin we observed in the dengue hemorrhagic fever. And one more bleeding site also we observed, that is called as a gum bleeding. There is a hematuria, there is a hemoptysis, right? So hemoptysis or hematuria, urine blood bleeding may be in the urine, bleeding may be in the vomiting. This common loss of bleeding most commonly observed that the dengue hemorrhagic stage, dengue hemorrhagic stage, and this stage is we called as a, there is a most loss of blood either by the internal or the external. And the next stage that is called as a dengue shock syndrome. See, here one point we should observe. Here there is a loss of blood. There is a loss of blood. So when the body losing the blood, at the same time here 2 points we observe. One is the platelet. So there is a there is a loss of we observe there is a loss of platelets, right? So there is a loss of platelets. There is a loss of platelets, and at the same time we observed there is a loss of blood, especially the plasma. due to the loss of character, so there is a plasma loss and the platelet. So there is a platelet and plasma loss. We observe that the blood is not able to maintain the volume, that pressure, right? So here there is a start the fall down of blood pressure, especially the BP fall down we observed. This BP fall down we observed that we called as a dengue shock syndrome. Dengue shock syndrome. So what happened exactly in the dengue shock syndrome is, here when there is a loss of the platelets and when there is a loss of the plasma and the RBCs, so by that the blood is not able to maintain the appropriate volume and appropriate pressure. So not maintaining by the volume and pressure, which leading to cause the cause called as a circulatory failure. The circulatory failure may be the Franke shock or the hypovolemic shock. So by that, especially we observed there is a narrow pulse pressure. The narrow pulse pressure, especially we observed there is a especially if you have to observe there is a less than 20 mm of Hg, hypotension can be maintained, especially there is a less than 100 mm of Hg, right? So systolic blood pressure can be maintained, fall down, right? So systolic blood pressure fall down less than 100 mm of Hg in the dengue shock syndrome. So that is very important point, you just remember. In the dengue shock syndrome there is a dropping of the BP, especially the systolic blood pressure can be dropped less than 100. So there is a dropping of systolic blood pressure less than 100. This condition we call as a critical dengue condition. So in the critical dengue condition goes to the fall down of the blood pressure less than 100 mm of Hg, systolic blood pressure less than the 100 mm of Hg, that leads to the cold clammy skin, and that leads to the confusion, that leads to the disorientation and unreachable of the blood pressure character, and there is a observing of the weaky and a thready pulse that leads to the coma, then finally the person will dead, right? So the deadly disease which cause the death, the disease called as a dengue we called as a very dangerous disease because of this fever, right? So by the following of the fever there is a causing of the death, the condition that is called as a dengue. So if you are not properly concentrating and managing the dengue, there is a cause of the death. So death may be traveled by this stage. The stages are classical dengue fever, there is a breakbone fever, and the stage may be the hemorrhagic fever, and the stage may be the dengue shock syndrome. So exactly point, you just remember that there is a only the first, the fever, high grade fever, the headache with the retroorbital pain and the severe muscle and joint pain can observe the starting, then make continuation with that. So there is a next the fever may be the acute or onset history, and here there is a fall down of the platelets and a fall down of the right? So plasma, and there is a fall down of the RBCs also. If we have to observe the hematocrit, there is the hematocrit levels also goes to the right? So change, and here we observe there is a manifestation, especially we observe there is a hemorrhagic fever manifestation can be observed. The hemorrhagic manifestation, bleeding may be the internal or external, especially most common sign can observe the bleeding may be the epistaxis, and there is a skin bleeding like a petechial bleeding, then purpura, then that may be the called as a ecmosis, and then continuation we observe there is a dengue shock syndrome, which very dangerous sign, critical stage. In the dengue shock syndrome there is a fall down of the blood pressure, so the systolic blood pressure is less than the 100 mm of Hg, which leads to the hypovolemic shock, which causes to the coma, and finally there is a death. So this is what the traveling of a dengue stage, and here the next continuation if we have to observe these slides maybe is not that much of visible, and I may try to right. So here there is a management of dengue. See, in the management of dengue, here especially daily the dengue management called as a dengue only. What mnemonic here? The mnemonic exactly the dengue. Dengue, the D stands for here daily monitoring is essential, and here E stands for increasing the fluid intake, that is very important, like a juice and any other fluid should be increased, and N stands for note any dangerous warning sign, that is very important, like a vomiting or bleeding, These are the most common dangerous sign we observed in the dengue. So N stands for note any dangerous warning sign, and G stands for here give only paracetamol. It's very important that you just remember the management of the dengue. See, the dengue is a RNA viral family. So antibiotics is not a proper management and a proper handling and a treatment of choice for the dengue, because of biotics act only the bacteria mostly, right? So here the RNA family of virus, this is a virus. So viral disease, there is no appropriate effect of a antibiotic on the viral disease, and you just remember that. So here we should not go for the choice of the antibiotic. Particularly we focus on give of the paracetamol only, because of here the patient is complained with the joint pains and the muscle pain. There is a severe characteristic of joint, muscle and bone pain. So there is only managemental drug that is called as a paracetamol, and we should not use other non-steroidal anti-inflammatory drug that we call as a NSAIDs. So we should not use the NSAIDs drug because of NSAIDs drugs which further leads to the bleeding. So here, so aspirin, especially the aspirin, diclofenac, such drugs we should not use in the management of the dengue, because of there is a increased choice of bleeding. So there is a increased choice of bleeding if we have to use the non-steroidal anti-inflammatory drugs like a aspirin. So if use the aspirin, there is a increasing the bleeding chance. That's why avoid the aspirin. Avoid use of aspirin and non-steroidal anti-inflammatory drugs except paracetamol. So here only G stands for give the paracetamol only, right? And U stands for use the mosquitoes net, and E stands for early consultations. So here early consultations by the physician is very important in the dengue condition. So if we have to observe the symptoms like the stages which we have to explain in the previous slide, so such symptoms we observed, immediately the consultation of the physician is very important to protect the child and the person from the dengue condition, right? So here this is what the dengue management, and here there is a dengue vaccines rarely we have to use, especially this vaccine we can use in the endemic areas only. This particular vaccine name that is called as a Denguaxia. So Denguaxia or CYD-TDV is a specially vaccine live tetravalent vaccine which we have to use the dose of 0 dose, 6th dose and 12 months. So 0, 6 months and 12 months is most the interval of dose which we have to using in the dengue vaccine. And age group, particularly there is a 9 to 45 years of age group which we have to use the dengue vaccine. You just keep in mind what exactly the vaccines can be advisable. So this is about the deadly dengue, right? So and continuation with this, if we have to observe, there is a one more condition which we call as a malaria. So if we have to observe the malaria, so the malaria mostly it's a protozoal. It's a protozoal disease. It's very important to remember. It's a protozoal disease. The parasite, especially in the malaria, the parasite that is called as a malarial parasite called as a plasmodium. So the malaria is a protozoal. It's not a viral. It's not a bacterial, and it's not a fungal. You just remember that malaria is a protozoal disease. So the protozoal disease, especially the parasite name called as a plasmodium. So if we have to observe the etiology of the malaria, in the malaria there are the 4 different type of variant can be observed, right? So in this 4 different type of variant, especially if we have to observe that variant that is called as a plasmodium vivax. Plasmodium vivax. So plasmodium vivax is a most common variant of species which we have to observe. There is a 70% of geographical distributions and morbidities can be observed. Most common variant of species that is called as a vivax, and there is a one more variant is there that is called as a plasmodium falciparum. This plasmodium falciparum we call as a cerebral malaria. cerebral malaria, and especially these conditions, or there is a 25 to 70% of cases if we have to observe, and there is this Plasmodium falciparum we also called as there is a black water fever. So this condition we also called as a black water fever, because of here in the Plasmodium, actually the variant of these two species, there is no RBC damage, but in the falciparum there is a damaging of the RBC. So there is a damaging of the RBCs, especially observed in the falciparum. So this is we called as a very dangerous type of species. So dangerous type is a falciparum. You just remember that the cerebral malaria and Plasmodium falciparum is a dangerous type. Most common type in the India, that is called as a vivax. According to the geographical distribution, most common type is a vivax, and most dangerous, that is called as a falciparum. This falciparum we also called as a cerebral malaria, right? So this cerebral malaria may be proportionated, and the percentage is 25 to 30%, and it also called as a black water, right? So fever, and mostly it can be observed that that is called as a they observed in the blood urine, there is a loss of the RBCs can observed, and most rare variants those called as a malaria and ovale. So malaria, ovale, both are the less than 1%, and these two are the most rare variant we observe, right? So this is about the different type of the right. So Plasmodiums, Plasmodium variants are majorly 4 types. Plasmodium vivax, most common type, there are the 70% of geographical distribution can be observed, there is a vivax cases, and Plasmodium falciparum, this 25 to 30% of cases we observed, especially this cases very dangerous of Plasmodium falciparum, because of they destroy the RBCs, and there is a cerebral malaria we observed, and here the next two variants which we call as a malaria and ovale, these two are the less than 1% we observed. So this is what right. So about the malarial classification, and if we have to observe the malaria, especially in the malaria, right. So the mode of transmission, how the malaria is transmitted. So as you know, the malaria is a vector-borne disease. So by the vector-borne disease, what exactly the vector? So vector, we know that that is called as a Anopheles mosquitoes. Anopheles belongs to the female Anopheles mosquitoes. So mostly all the mosquitoes which causing the diseases are the female mosquitoes only. That is what the point you just remember. And here there is a Anopheles mosquito which causing the malaria. This Anopheles mosquito also in the two variant we observed, especially the Anopheles that is called as a calciphilus. So Anopheles calciphilus especially in the rural, and there is a Anopheles stephenici, there is a urban. So there is a stephenici, Anopheles stephenici, which mostly spread in the urban, right. So and there is a Anopheles calciphilus, so Anopheles calciphilus mostly we in the rural. So these two are the most common variant which we have to observe. So and here if we have to observe the transmission mode in the mosquitoes, so the mosquitoes we termed as a primary host, and humans we termed as a secondary host, and here there is a definitive host we termed as a mosquitoes, and the intermittent host are the humans. And especially if we have to observe, it's a very important point. So this Plasmodium or sexual cycle in the mosquitoes, it's very important. Plasmodium, so Plasmodium, especially the Plasmodium, there is a sexual cycle in the mosquitoes and asexual cycle in the human. It's very important to remember. There is a asexual cycle in the human Plasmodium and the sexual cycle of Plasmodium in the mosquitoes only. And when the Plasmodium is infected, so the character of a infection, when the Plasmodium is a character of a infection, so infection, so here the character can be observed, that is called as a sporogony. So this sporogony is a stage which the Plasmodium can be infected. When the Plasmodium at the sporogony stage, this mosquito is biting the healthy person, so the healthy person may be infected with the malaria. So the malaria wants to infected to the healthy person at the stage of the sporogony. So sporogony is a stage of infecting the malaria and infecting the disease, and in the human also there is a stage of spreading the infection, that stage called as a schizogony. So schizogony is a stage of the human, and the sporogony is a stage of the mosquitoes. So plasmodium at the stage of the sporogony can mosquitoes which bite the healthy person can transmit the malaria, and at the same time humans when the stage of schizogony, so schizogony stage is the stage which spread the so mosquitoes which spread the malaria by the mosquitoes to the another healthy person. So what will happen in these two stages? Let me give the clarification here. In the sporogony, so the sporogony stage, the mosquito bites to the healthy person, the person is affected with the malaria. At the same time, when the human, when the plasmodium at the stage of the schizogony, when the schizogony stage of this plasmodium, the mosquitoes will feed the person. So this schizogonic variant can be transmitted by the saliva into the mosquitoes, and which has to spread. So here the sexual cycle may be in the mosquito and asexual cycle may be in the human. This is what the variant you just remember. And next continuation, if we have to observe, there is a incubation period. So in the incubation period, particularly if we have to observe, in the incubation period here in the mosquitoes, so plasmodium incubation period is a 14 days. Plasmodium incubation period is a 14 days. This 14 days incubation period is a variant of plasmodium vivax, especially the 8 to 17 days. This is what the range, and here the accurate days is called as a 14 days. Plasmodium vivax is a 14 days, and Plasmodium falciparum, the incubation period is a 12 days. See, the least incubation period variant, that is called as a Plasmodium falciparum. So this falciparum, so we call as a least short, we call as a short incubation. So short incubation variant, that is called as a Plasmodium falciparum, and Plasmodium vivax incubation period is a 14 days, and there is a Malaria and Ovale. These two are the only 1% variant. So there is a 28 days and 17 days of incubation period can be observed. So that variant, right, so especially we observe, right. So this is what the different incubation period, especially you just remember the falciparum is having the less period for the incubation, and vivax is having the 14 days of the incubation period. If you have to observe the clinical manifestation of the malaria, especially there is a 3 stages, right, stage 1, stage 2, stage 3. So first stage we call as a cold stage. So what particular character in the cold stage is, there is a right, so headache and nausea and chills, and there is a, if we have to observe, the stage may be continued, there is a shivering may be start, right. So this shivering, especially we observed, there is a temperature can be maintained, and shivering especially we observe the stage that is called as a cold stage, and temperature can be maintained in this stage that is called as a 39 to 41 degrees Celsius. That can be observed, the cold stage is 15 minutes to 1 hour. It's very important to remember. So the cold stage we observe there is a 15 minutes to 1 hour, and here the next after the cold stage there is a stage called as a hot stage. This hot stage we also call as a hyperpyrexia stage, right. So hyperpyrexia stage. So hyperpyrexia stage. So in this hyperpyrexia stage there is a increasing of the temperature can be increased, and the stage can be, right, so 2 to 6 hours. 2 to 6 hours can be observed the hyperpyrexia stage, and followed by the stage that is called as a sweating stage. This sweating stage especially we observe there is a sweating, right, so profuse sweating can be observed 2 to 4 hours. So the duration is very important, that there is a cold stage can be 15 to 1 hour, and then followed by the next stage that is called as a hot stage. The fever can be maintained 2 to 6 hours, and there is a sweating stage which we observe there is a 2 to 4 hours of sweating. So this is what the stages of fever. This fever we simply call as a Rigo fever. The fever variant we call as a Rigo fever. So Rigo fever is a variant of fever which we have to observe in the malaria. So in the malaria, the fever variant called as a Rigo fever. Rigo fever into the 3 characters: cold, hot, sweat. So cold, hot, sweat is a 3 variant character can be observed. First 15 to 1 hour can be cold, followed by the 2 to 6 hours are the hot, then 2 to 4 hours, then after followed there is a stage of the sweating. If we have to observe these 3 stages, we may let us go to the provisional diagnosis of the malaria, right. So in the next continuation, if we have to observe there is a malarial test, the test may be called as a blood smear test. That test called as a blood smear test. So in the blood smear test, what exactly we observed is, if you are preparing the thin film, so the thin film, so this thin film which we have to help for the detecting of the species, and the thick film which we are helping for the searching of the parasite. So these 2 variant you just diagnostic variant you just remember that. So in the blood smear, if you have to preparing the blood smear slides, in that slide the thin film slide which we have to help for the detecting of the species, and there is a thick film slide which you have to help for the searching of the parasite. So this is what the most commonly malarial. There is a rapid malarial diagnostic test also available, right, also as you know well. And here if we have to go to the continuation, there is a treatment particularity. So treatment there is a for example, if it is a Vivax variant, most common variant is a Vivax. So if the Vivax variant, there is a 3 days of treatment we particularly concentrate. In that, the day 1 that is called as a tablet, the tablet called as a chloroquine. So chloroquine CQ tablet, that should be the 600 mg, and there is a primaquine, so PQ, shortcut CQ and PQ. So CQ and PQ combination day 1, and day 2 only CQ, and day 3 only CQ. This is what the treatment modality, you just remember that. So in the day 1 there is a chloroquine 600 mg plus primaquine 45 mg, and day 2 there is a chloroquine only, that is called as a 600 mg. At the day 3 there is a chloroquine 300 mg, and a continuation with that we observed if there is a confirmation of the species. So in that it's a Vivax variant, especially we can continue the paraquine, that is called as a PQ, that is a 15 mg per daily for 5 days continuation. And if we have to observe there is a falciparum, there is no further changes of the treatment needed for the falciparum, right. So only the variant can be observed in the Vivax. We observed there is a PQ can continue the 15 mg for the 5 days, right. So there is no further treatment can be held for the falciparum, and we are not supporting with the falciparum treatment. So here this is what the treatment modality if we have to observe. So treatment modality, once again I am repeating, there is a 3 days of the doses. Day 1 especially there is a CQ, and day 2 there is a PQ. So day 1 there is a CQ and PQ, and day 2 only is a CQ, day 3 only the CQ, right. So there is a if there is a radical treatment, particularly if you have to observing the and confirming the species variant, that variant if the Vivax, we continuation of the PQ 15 mg for the 5 days. So this is for the treatment modality which we have to observe in the malaria, right. So this is about 2 dangerous vector-borne diseases which we called as a malaria and the dengue, right. So in next class we can continue what exactly other variant, right. So thank you.